Hello, I'm Matthew Weinstock, Managing Editor of Modern Healthcare. Thanks for tuning in to the latest edition of The Checkup. According to the Kaiser Family Foundation, about 36% of adults have said they've experienced symptoms that are consistent with anxiety or depression during the COVID-19 outbreak. That's up from 25% at the same time last year. And with no real end in sight for the pandemic, mental health resources are going to continue to be strained across the country. I'm happy to welcome Deborah Visconi to the Checkup today. She's CEO of Bergen Newbridge Medical Center in New Jersey, which has really been trying to tackle some of the mental health issues in their community since the pandemic started. In fact, the medical center recently received an $800,000 federal grant to work on some suicide prevention programs. Deborah, thank you so much for being with us. We know it's a busy time.
Thank you, Matthew, for having me. It's my honor and pleasure.
So let's talk a little bit about what you've seen on the behavioral health front in your community. If I'm right, you've said recently that you saw like a 30 to 40% spike in behavioral health needs over the course of the pandemic. Is that right?
Yeah, actually, Matthew, that is fairly accurate. Since the pandemic started in early March, we had a little bit of a lull for the first month or so, but then over the last 2 months, we've definitely seen an increase in individuals that are seeking behavioral health care from our medical center to the tune of about a 30% increase in people coming to us.
And can you sort of quantify how that's manifested itself? Are there certain types of patients that are seeking that kind of help, or is it across the whole spectrum of your population?
It's actually across the whole spectrum. We're seeing PTSD, depression, anxiety, suicide, ideation. So we're seeing a little bit of everything. And so it's really, we have a very large behavioral health program here at Bergen Newbridge Medical Center, from inpatient behavioral health care, outpatient care, partial hospitalization, medication-assisted treatment programs. So we offer the full gamut of care.
And so what are some of the things that you've had to implement to try to address some of the challenges and behavioral health needs of your patient population?
So we've focused primarily initially on our first responders and our healthcare providers. We started to see an uptick in individuals that needed counseling or groups, or just really having appointments with our psychiatrists. So we've seen increase in all of those areas of need amongst our healthcare providers, not just the ones that work here, but throughout the community, our first responders throughout the community, our EMS professionals all around. We're seeing an increase there. And then we're seeing increases in our community. We work with Care Plus NJ, which is a community-based behavioral health provider, and they manage our helpline, our 262 helpline. So we're seeing an influx of individuals that are calling that helpline that are in some sort of crisis that need our services.
Let's focus in on the first responders and even your staff, because we saw the spike early. We're seeing some rises continue on. Just what kind of pressure does that put on you as a health system when you're not just treating patients who may have those needs, but also your staff and the emergency responders that you referenced? With limited resources on behavioral health. Even before COVID-19 started, we had limited resources.
Yeah, that's where the value of partnership comes in. Certainly working with our community providers is incredibly helpful. It gives us additional bandwidth beyond the walls of the hospital. And in terms of resources, federal funding has been vital to our medical center. We are a safety net provider. In addition to being the largest hospital in the state of New Jersey, we are a safety net provider. So any funding, whether it's through CARES Act or other funds, in this case, we're talking about the federal grant that came through from SAMSA for our suicide prevention program, that is vital to our ability to continue to provide this care to our communities.
Can you talk a little bit about how that SAMSA grant will be utilized? What are you doing with your partnership, and how do you get that out into the community?
So what the grant will help us do is expand our current capacity. We currently have professionals in the community and as part of our medical center that are caring for these individuals that are at risk for suicide. And so the SAMSA grant will allow us to expand that bandwidth and allow us to recruit additional staff to help us in the community, to identify individuals that may be at risk, to also provide training for other community providers on how to identify individuals that may be at risk and how best to help those people.
And so when you think about recruiting, how does that play into it when we've had a shortage of staff and professionals who can deal with some of the behavioral health crises that are impacting people? Do you find that there's enough people out there to recruit?
Yeah, some job titles are a little more challenging to recruit for. We have partnerships with many of the colleges in our community, and so we're able to recruit students that are either about to graduate or some that need internships to fulfill their clinical rotations. So we do have partnerships with many of our schools, and we work very closely with our human resource and talent acquisition team. We're always out there recruiting and looking for talent that we can bring to the medical center.
So as you think about your peers across the country who, are trying to tackle this as well, what are some best practices that you've been able to implement that maybe they could follow, even short, if they're not going to get a grant, but are there certain things they could do to try to look at addressing behavioral health challenges in their community?
It's important to understand what your community needs are. It's important for hospital leadership to be out talking to the community and really understanding where some of the gaps may be or where some of the areas of opportunity. We're big believers in training, so offering training, developing training programs, I think is a vital thing that people should be looking to do. And really keeping, we keep our finger on the pulse of what's going on at all times. We listen to the people coming through our doors. We listen to our own frontline staff. There's no better group than the people who are on your front lines, your frontline caregivers that see what's going on and can give you good, relevant feedback so that we can act on it. We're a large medical center, but we're nimble, and so we are ready to act to support our community, our patients, our first responders. And so that's been very helpful to have that flexibility to pivot when you need to.
And I think this kind of fits into that. In June, you guys opened a new medical healthcare center for the LGBTQ community. Can you talk a little bit about just the focus behind that, and how does that fit into some of the work you're doing on COVID-19? Because they are, an underserved population as well.
That's a perfect example of the way we keep our finger on the pulse. We know that the LGBTQ community is underserved. It's a stigmatized community, and we've heard from our community that they need a place to call their own, a home where they can seek medical care. And so because of that feedback, we worked with our providers and decided that one way to address that those gaps in care is for us to open a healthcare center specifically to address the needs of the LGBTQ population. And COVID, like any other disease, whether it be chronic or acute, is one of those areas of need. And so we're going to be able to address the needs for this community, COVID and non-COVID, chronic conditions, men's health, women's health, cardiac issues. So we're, again, this is one of the ways that we've been listening to our community and being able to respond to it.
So let's look to, going forward, we're seeing, spikes across the country, as you know, and obviously some areas that have opened up, people are going out to large gatherings, the beachfronts, bars, restaurants, those types of things. As the leader of such a large system and a safety net, how are you communicating to your community about the importance of masks or social distancing or getting this thing under control as we head into the fall?
Yeah, that's been a challenge for everyone. We have a huge social media presence. We have huge connections to our community, so that anything that we put out educational wise or information wise, we put out to our community partners. Social media. We recently launched in partnership with the County of Bergen, we launched a huge mobile testing program specifically to address the needs of our communities that may not have an opportunity to come to testing. And we serviced 70 towns in the county of Bergen. We did close to 50,000 COVID tests right in our community. And that gave us an opportunity to get the word out to our community. So they view us as an asset, as a resource. And the questions that are coming from the community in terms of, COVID questions, what do we do? How, what's the importance of masking? Really has helped spread the word. Working with our county of Bergen, with our county executive and his team and his health department, really has been very important and pivotal for us to be able to get out there, our health educators, and spread the word.
So that partnership with government agencies is really critical at a local level, it sounds like.
It is. It's been a whole of community effort for us, from the county's highest leadership all the way to the hospitals and the community partners. Absolutely.
So then, lastly, Deborah, as you think about, again, as we move into the fall and trying to get some of this under control, what do you think we need to see out of a state and national level, especially, again, coming back to what you're seeing on a behavioral health front? Are there things that you need to see at that state and national level to help you try to get some of this under control?
Funding, that's really, it's significant for not just us, but for all healthcare systems across the country. The amounts of money and resources that we have to expend on testing people, staff, long-term care residents, the incremental expense for PPE. That's the other piece that's also vital for healthcare systems and hospitals, is access to PPE as we start to prepare for the eventual next phase. We're all looking for the same PPE across the country now that the rest of the country is hot. Everyone's searching for the same thing. Access to staffing, nurses, CNAs, other types of healthcare professionals is vital for us. And just a continued support of what we're doing and continuing to get the word out that this isn't over, and we all have personal responsibility to help continue to combat the virus.
Sure, and this will be the last one, I promise you. As we think about the coming up flu season, what are you doing to plan for COVID, flu colliding together here?
A lot of planning. We have things that we learned from the first go round, things that we know from previous seasons of flu. We want to make sure our staff is protected, so we make sure that all of our staff gets the flu vaccine. COVID flu is going to be very dangerous. The vulnerable populations, our elderly, our children, they are very much at risk. And so we want to make sure that everyone gets their flu vaccines. Obviously, when the COVID vaccine is released and available, that's something that we're gonna promote as well, to make sure everyone gets a COVID vaccine. And wash your hands. Some of the basic things of infection prevention are to wash your hands. Don't touch your face. Stay away from large crowds. Wear that mask or face covering when you're with other individuals. Everything that you've been hearing, but it has to continue. Right.
Listen to your mom, basically. Your mom's orders when you were a kid, right? Wash your hands.
Exactly.
Well, Deborah, listen, I appreciate you taking some time. I know these are some very, very heady issues that you're dealing with: behavioral health, the flu, all those things. We appreciate you taking some time to talk to us and share your experiences with our readers and our audience.
It's been my pleasure, and thank you for having me.
Thanks so much, and stay safe.
You stay safe. Thank you.
And I'm Matthew Weinstock with Modern Healthcare. Thanks so much for tuning in, and be sure to come back next Monday for the checkup.